Dear students, today we are here to continue our topic, that is antithyroid drugs. In this session, we will study about iodides, their mechanism of action, their preparation and doses, and a bit detail about the radioactive iodine. So let us start with the iodides. Iodides. Before starting iodides, let us study first Wolff-Chaikoff's effect. Wolff-Chaikoff's effect. In this effect, large amount of ingested iodine cause inhibition of secretion of thyroid hormones. Irrespective of TSH levels in serum. Means large amount of iodine inhibits thyroid gland from its secretion. From the secretion of thyroxine hormone, irrespective of a TSH concentration in the serum. Means thyroid gland fails to secrete thyroxine in spite of TSH concentration in the serum. Thyroid gland does not respond to the thyroid stimulating hormone which comes from the pituitary. This effect is known as Wolff-Chaikoff's effect. Iodides follow this very method in decreasing the thyroid gland secretion. So let us first study about now. This was the Wolff-Chaikoff's effect. Now let us study about the mechanism of action of iodides. Mechanism of action. These iodides act by decreasing the response of thyroid gland to TSH. TSH is a thyroid stimulating hormone which comes from the pituitary. So these iodides make the thyroid gland not to secrete a thyroxine in response to the TSH. And this effect is also known as thyroid constipation. So this was the mechanism of the iodides. Now coming to the physiological action of thyroids. Number first, it causes decreased thyroid hormone secretion, that is decreased thyroid hormone secretion. Number 2, there is a fall in basal metabolic rate. And the gland becomes, number 3rd, is gland becomes less vascular and firm. Gland becomes less vascular and firm. These are the actions performed by the iodides in our body. Now coming to the adverse reactions. adverse reactions. There are a number of adverse effects of the iodides. For example, allergic reactions like skin rashes, conjunctivitis. Conjunctivitis is the inflammation of conjunctiva. Swelling of lips, and salivary glands. These are the common adverse reactions with iodides. Iodine overdosage now. Iodine overdosage leads to iodism. This is characterized by the lacrimation, excessive salivation, metallic taste, and burning sensation in the oral cavity. Burning sensation in oral cavity and sore throat. Lacrimation is the flow of tears. These are the common symptoms of iodism when there is an excessive overdosage of iodides. So this was about the adverse reaction. Now let us study about preparation and doses. Number first, sodium iodide. Sodium iodide, its dose is 6 to 10 mg daily. 6 to 10 mg daily. Potassium iodide, same dose, 6 to 10 mg daily. Next is the Lugol's iodine. Its dose is 0.3 ml daily. Lugol's iodine is 5% iodine and 10% potassium iodide. So this was about the preparation and doses of iodides. Now coming to the uses. Uses of iodide. It is used in the preoperative preparations. For thyroidectomy. Means it is started before surgery for about 10 days so that the gland becomes less vascular and firm. Next, it's also used as in thyroid storm. When there is a sudden and excessive release of thyroxine that is controlled by the iodides. It can be also used as an antiseptic and as well as an expectorant. So this was the uses of the iodides. Now coming to the radioactive iodine. In this case we use I-131 isotope. This isotope of iodine is a radioactive isotope and is used in oral solutions. Like other normal iodine, it's absorbed and trapped in the thyroid gland. Its half-life is about 8 days. 8 days. It emits beta radiations, which pass only to 0.5 to 2 mm of tissues. 0.5 to 2 mm of tissue of thyroid tissues. Hence, these beta radiation destroy the thyroid gland cells without causing destruction in the surrounding cells. This was about the radioactive iodine. For further details, we will continue in our next session. Thank you.